tag it.
You tag it right,
Yeah,
set it to
out
the
of the
side.
room.
But your bacteria is still okay.
Oh, yeah, my back
Yeah,
feels
it's
fine.
still sterile, there's just not.
Quality
not
control
the right
wasn't
number.
good at that company that day.
Gotcha.
That's why you counted it.
You will also see people trying to get away with this as a count.
I'm videoing it for.
Oh, I'm
Thank you.
sorry.
No,
I
I'm
didn't
just
mean to
saying
get in your way. Okay.
if you, I'm gonna try to post
Yeah,
it.
that'd be great.
This doesn't count either, guys.
Oh, spreading them out like that?
Yes, just because you can see that, that don't count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. No, pick them up. 1. And you'll have some nurses that will get down on you. 2, 3, 4, 5, 6, 7, 8, 9, 10. Like that one much better. Laps. Again, there's a little paper around them. Throw it off. Separate them again. 1, 2, 3, 4, 5. Okay? Going over to sutures, I have 1 suture. Some places will make you open the suture pack to show you the needle, others won't. So go by the hospital policy. 1 suture, and I have 1 blade. We're
And
gonna go
what
a
about
little
a
bit
Bobby tip?
further. We're gonna go to 1 Bobby tip, and if I had a Bobby tip cleaner, I would count that too.
And you have to show them the Bovie tip
Yeah, you have to
and the
take it out.
Bovie tip cleaner. You can't just say, I have one.
Yeah.
They're gonna wanna see it.
Because there again, it could have been a bad day at the manufacturing place or plant and they forgot to put the tip on it. Okay. So from there, if I have anything else, if I have cotton noise or anything else that's a counted item, I have to count it.
How
Okay?
do you count if you have, let's say you have 3 packs of Ratex and 2 packs of Laps? How do you count those?
Separate, okay? Individually, okay? I'd go 1, 2, well, let's start with these. These are easier. 1, 2, 3, 4, 5. Another pack I have, let's say. 1, 2, 3, 4, 10. Okay? Another pack. 1, 2, 3, 4, 15. Okay? What do they come in?
Fives.
10. All right?
Ratex are the same way.
Yep,
1 through 10, 1 through 20, 1 through 30, 1 through 40.
yep. Okay? Yep. So that's done. So now we want to count our instruments, right? Okay.
You ready?
Which side are you starting on? Sponge sticks or hemo?
Towel forceps.
Okay.
Towel clips.
1,
I would never
2,
do this.
3, 4. Okay?
Okay.
This is one of the best things you can use when counting on your clamps.
You can either use that or you can use
Or
a forcep
forcep.
upside down backwards.
Yep.
Use the tip of it.
Yep.
But they need to see, so usually they'll be standing beside you or they'll be standing over
You
here.
should be over
Right where-
here.
Yeah,
Right,
but
yeah.
let me show, do you want, how do you want me to show them both ways where they call it out or we call it out before we come in?
You're gonna have to call it out now. I mean, they
Yeah,
can't do it.
no, I know they can't, but I'm saying.
I would let, yeah.
Like usually when you come up, you'll see different people count different ways, but you'll go, towel forceps or towel clips.
1, 2, 3, 4.
Okay, now there's 6 on here,
Okay.
so there's only 4 there, so we're gonna write on here that there's 2 missing.
Okay.
Because you have to put what's missing from what I'm supposed to have and what she actually has. So when the count's right, we make sure that, okay, well, there was 2 missing, so yeah, we didn't leave those on the patient or in the trash can or something. Okay, hemostats,
Hemostats 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Kelly's,
1, 2, 3, 4.
Alice,
1 too short, 1 too long.
okay.
Okay? Short and long, they're gonna wanna know. Okay? Babcock?
Babcock's,
1 too short, 1 too long.
okay. Needle holders, and so usually, or it's according to how the nurse, but a lot of times they'll combine them and just say how many needle holders
Yep.
you have.
So I have 1, 2, and 3.
Okay.
You would have
Scissors,
to say-
Scissors, they'll
No.
combine them
Okay.
too. Okay? Because they're not gonna go 1 Mets, 1 male, 1 this, all
but
together.
some do. It's
Yep.
according to whatever you count, however your circulator wants you to count.
Yep.
That whatever they're comfortable with.
Follow the nurse's lead on this, you guys.
So scissors,
1, 2, 3. Or 1 male, 1 Mets, and 1 suture.
okay, there's
Okay.
also one missing.
One
So we would
missing.
mark it one missing. We would go over it again. I'll say one, and then if there's, since there's supposed to be 4 and there's 1 missing, then we're gonna go back and I'm gonna say which ones do you have, because there's 1 missing.
Yep.
So that we know to
Which
mark the
one?
correct one missing.
And the one that's missing, the person downstairs is to note this, and when the tray comes back, it's supposed to be complete.
Right.
Yep.
And sometimes they just can't find them, they're broken, the hospital hasn't, you've used them all up because they get lost or thrown away or whatever. So you will see trays that have missing instruments, but the goal is to get a complete tray, because you never know what you're gonna need in the OR during a surgery.
They're really pretty good these days too. If that tray's missing something, a lot of times it'll be labeled right
Well, it
on
has
the
to be
top.
labeled now in CC
Yeah.
and CSS. They have to label it. If it is not labeled, it is gonna come back to the tech, because you'll have your name or whoever's name on the paper on who put that tray together. And if it's not written on the outside, you're gonna, not you, but the bosses, it's gonna get turned into the bosses, and they're gonna, that tech will get in trouble for not labeling it. Because what if it wasn't labeled and you need it for that surgery?
Or you
So-
open that tray specifically for that instrument, it's not in there.
And it's not on the
You're taking
outside.
more trays down that, you know, you shouldn't be.
And you're keeping patient under anesthesia for longer than they need to be.
Exactly.
Okay, sponge forceps, sponge
One,
sticks.
two.
Those can be called sponge sticks or sponge forceps.
Okay, what do you have?
Okay, your stringer, you always
I
count
have
your
my stringer
stringer.
right here,
Okay.
and I always show them that, okay?
Number 3, knife handle.
I have 1, 2,
Okay. Forceps.
1, 2, 3.
Okay. Richardson retractors.
I have 1, 2, 3, 4, 5, 6 Richardsons,
Okay. Cushing vein retractor.
1 Cushing,
Okay, we're supposed to have 2, so again, you'd mark it missing. Sin retractors.
1, 2,
Army Navy retractor.
1, 2.
Wheatlander.
I'm missing that too.
Okay, God, this tray stinks.
Of course I grabbed the
Yeah.
one this morning.
I know.
You know, we had
I'm
one
gonna have it
perfect and one that
So
wasn't.
that's how, any questions so far on a quick count of instruments? And Raytex and laps and sharps?
If you open a multi-pack of suture and you don't pop it at the time of the count, when you pull the tape and open it, you count 1, 2, 3, 4, 5, 6, 7, 8, just so the circulator or knows that you've got 8 needles coming out of that pack.
And
'Cause
they would just
sometimes-
add that to the count.
Right.
She's gonna grab one and we'll show you.
Once
She
you
does show
open,
you,
they
yeah.
count it and then it gets added to
I
the
have
count.
one
Well,
suture.
a lot of times, you'll go ahead and put it in your count, but when you pull it, you still count to make sure they're right.
Do another count with the
Because sometimes
circulator.
you may
Is this okay,
start with 4 packs of
that?
pop-offs, so you've got 32 needles.
Here's what a multi-pack can look like.
Yep.
So you have them all in it.
So there's a bunch of needles in there, and again, we do not assume in surgery.
And then there's some packs that you can't see the needles.
Exactly, it's completely covered.
Yep. All right, so I have my back table pretty much set up. Tray is going here, instruments down the middle, bowls up on this side, this over here. Now, if I'm gonna set up my mail stand, what are we doing, like a hernia?
Yeah.
Yeah.
That's good.
1 clip, okay, 1 each. Put these clamps up. And we'll go a few of these, one of this one. Suture. Suture. And I'm gonna take 4 sponges, 1, 2, 3, 4, put them up here. And I'm gonna go retractors there.
You may want to throw Babcock up there.
Yeah. She's getting me. And how about a P, or let me have a pen roast too, please. Okay, so that's my basic setup, although my knife handle is on, okay? I might as well go ahead, you guys. See that? Might as well, because when I pull up to the table, when I get up there and all draped and stuff like that, I find myself that if it's there, they're gonna help me do it. You know, if it's laying up there, but if it's laying on my back table, then I'm gonna be the one that's responsible for it, okay? So we're pretty much, all I need really is my saline.
And
And-
you need some pickups.
Yeah.
Oh,
Pick up. And the other thing you want to do is when you have trash,
there we go.
and you can do the trash on your table 2 different ways. You can throw it away as you go, or you can save it in a little pile, because you don't want to make a million trips to the garbage can when you're trying to set up your back table. Pick a little spot in your mind, say, okay, this is going to be my little trash area, and put all your trash there. Then when you get through at the end of setting up your back table, just take that handful of trash and throw it away.
Really and truly though, in your packs, you have a baggie.
You have a bag.
Yeah.
And there was an Eagle
But
map
you
that
usually-
had one.
You tape it to the side of your table and you
Like
can
off the
drop-
side right over here,
No, on the front.
on the front.
And you just drop stuff in it.
Oh, there it is, good.
Tags for your laps and stuff.
Small, yeah,
See, even
small
on your
stuff like
Baldy
she
stuff.
said.
And this usually comes with the needle
Put it there.
Yes, or it usually
So I
comes in the
have-
pack.
in the
There you
back
go.
table
There's your
pack.
I have my
baggie.
little bag, and you can
Surgery.
pick.
tape on them too.
You can pick and choose where you wanna put your bag, if you want it on the front, if you want it here. Now, remember,
It's,
if it goes there,
You can't touch it.
you can't dig in that thing.
well, you can't dig in it, period.
No, you
According
can't.
to the book, and you will see this done, but according to the book, you cannot stick your hand down in it.
No,
And the
'cause it's-
argument is, but it's sterile inside.
No.
But the argument is, it's not sterile because it's below
Below the
table
table.
level. And you will see text tell you, no, that came sterile, it's sterile, I put it there, you can stick your hand in. Do not stick your hand in.
But if something gets put in there and should not be there and you need it, you can pull it off and drop it and your circulator can go get it.
Or
So,
you can even hand it to them.
Yeah.
Remember how we said make your circulator your friend?
Yes.
If they're sort of standing around or they know what's going on,
They'll
don't
be
just
there.
drop it.
Well,
Wait a half a second for them and hand it to them.
A perfect example is if you have a needle count that's wrong. If you save these needle packs, throw them
Yes.
in that garbage bag, at the end you're short a needle, you can go back and match every single needle to the pack. The nurse can, go dig through your bag from you and you can match up needles. So don't ever throw your suture packs away. I mean, garbage bags are wonderful things, you guys will find out. What else? I like to, and I bet you guys do too, I always pull my needle holders out, you guys. Because you're gonna use these needle holders over here by your sutures and stuff, and I always lay them right next to my needle mat. Is that where you do too?
I lay them
I
out,
put
but I
one
don't
on
lay
the
them right there.
mayor.
I
Yeah.
do too. I always have a needle holder. Usually you can have, if I know I'm gonna use it for the case, because it may just be you and the surgeon. I'm like her, I put mine up on the Mayo.
Yep.
And even if I know I'm gonna use my suture after it's been counted,
I do too.
I will go ahead and load my needle holder and put it up on the Mayo.
I do too, yeah.
Because if it's a small case or whatever.
When you
But-
load it, do you make sure, do you just like point it down so you
Well,
don't touch it?
I'm gonna open this one.
Again, it's also gonna be the text preference. A lot of texts like it different ways. See how she does it?
Some you will find that they are, they'll go in their needle mat with it. No, I'm blind, I can't see the thing, so I don't have glasses on. Some you'll find it like that. I like to, especially on hysterectomies and stuff, I like to bring it up, kind of tuck it underneath my sponges hid, that the needle is like that, kind of buried. That I
That's what I was
know
wondering,
it's
just so you
there.
don't get stuck,
So
I guess
don't
was
get
what I
stuck,
would.
Because if I'm leaving it back here, floating out and stuff, and I'm standing over there, I can get poked. So if I go up and away from myself, then I can do it.
One reason not, remember how we said different texts do things different ways? A reason why I don't cover mine with sponges is because number one, it gets hung.
Yeah.
And when you go to grab it, then you could jerk the needle holder, you could contaminate your needle, you could forget it's there, the surgeon doesn't see it. You're retracting, he says, don't move. He goes, thinks he's gonna grab a sponge and grab it. And
Yes,
so,
and
you
this
know,
is-
different ways.
This is just, I mean, we've all
Yeah.
learned our own different things.
Exactly.
And I mean, I'm a kind of a territorial mail stand person some days, that if they come up on my mail stand, they might get in trouble. But there again, you'll find your own little thing to do with it.
Exactly.
And your techs will teach you all their different ways. My towels here are really boring compared to nowadays. They snake them and they do all these fancy things with
The
them.
only time I snake them is when
That's
it's
awesome.
a big procedure and a lot of
Exactly.
heavier instruments.
But you're gonna see so many, we just wanna teach you guys the basics.
Do you wanna
okay?
show them how to do a roll?
Just a roll towel?
Yeah, it's like that so they'll know.
I like to take it this way personally for a short one. This is a short one, guys, okay? Fold it up and just roll it tight, okay? I've seen people like to put garbage bags in them. Have you seen that? To make really stiff towels, which is a waste of time, you guys. So if you have a nice one, a nice fat one, it will stay on there. Now, if you have like a major tray or a bunch of trays, you can always do two to make it stiff too. Just come on in there, roll it tight. This would be a really big instrument tray. This is a small back table too, you guys. Okay, if I have a big case, I'm gonna have a big table that's gonna go out to here, so I have more than enough room to stack my, stuff on. Like so.
And you can, we're telling you like her way versus my way versus Miss Luckett's way, just to show you different ways that different texts do it. Another thing, you can spread it out like this, or you can be more compact, because you don't know when you might need an end of the table for something, that you may be retracting or doing something, the assistant may want to use that table for specimens or different things. You can make it more